Thank you.
If anybody that's here who wanted to say something who didn't get signed up, okay. I haven't seen it yet, so I don't know if anybody even did necessarily. But.
Yes, we have someone.
All right. Shall we? I will go ahead and call this to order and roll call, please.
Mr. Kern?
Here.
Mr. Lanier?
Here.
Mrs. Psalm? Here. Mrs. Young? Here. Mr. Sharp?
Please. Justin, you want to-
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, thank you all for showing up on an emergency night here, I guess, to discuss what is certainly an interesting topic as of late. So we've got four people who signed up, said they would like to make some comments. I guess we'll probably do that before we get into our discussion. I would just say that everyone please be respectful and courteous to others and what they have to say, and let's have a productive conversation here with some of this stuff and see what comes of the night. So first on the list, Angie Roberts. You said yes.
Hi. My name is Angela Roberts. I am the mother of 4 children in the district, and I am here tonight because I teach my children to stand up for what is right and for truth. And if I didn't do that, then I would be hypocritical. Beginning March of 2020, I began bragging to everyone I knew about how well Amanda was handling this unfortunate predicament we were dealt. I stand firm in that sentiment today. I appreciate everything that the staff, administrators, and board has done to keep our kids in classrooms as much as possible. AC students have had an advantage over many other students in this state. They have an administration, staff, and board who truly has cared for the well-being of students throughout the last 18 months. Our students, however, are not immune from the side effects of the prolonged measures being required of the state and local health departments. The guidelines that our local health department have set are complete tunnel vision at best. What is the limiting principle here? How far do we follow the health department and their guidelines? This month it's masks and quarantine. What will it be by next month or next year? How far will we follow them? Do we need to change our school's mission statement to control all COVID spread instead of the inspiring message we currently have? Of course, we should follow the health department when there's data and science to back up what they are suggesting, but what about when there's not? They are asking us to quarantine healthy children just because they were exposed, when in reality, these same children are probably exposed many times at various other public places throughout the week. Of all of the students who were quarantined last year, how many contracted the virus and tested positive during their quarantine? That would be a valuable piece of data to have moving forward. Has the health department provided us with this data, and if not, why? Most of us wear seatbelts because the data is there that seatbelts save lives. Does the same data exist here? If it did, wouldn't it be blasted from the rooftops so that there wouldn't be as much confusion as there currently is? Why do I say tunnel vision? Well, what exactly does quarantine mean to you or to I? I would assume if you have children and they are quarantined, you or your spouse call off work, stay home with them, help them with their schoolwork. No big deal, it seems. That's what happens in my house. However, not every student in this district is so lucky, obviously. Let's think for a moment what we're exposing children to while they're supposedly staying safe at home. Abusive environments, loneliness, depression, hunger, staying with elderly grandparents who are more at risk, anxiety over completing school assignments alone, and more. I overheard many Google Meets last year where it was very apparent that these students were home alone, and that was kindergarten and 3rd grade. The health department is exclusively focusing on the risk of the virus, completely ignoring so many other dangerous things, much more dangerous statistically than the risk of COVID in children. Of course, I'm not saying we can ignore COVID altogether, but is it possible that it's time to reach out to other local healthcare professionals to see if they are suggesting the same information? To avoid quarantine, this leaves us with masks as the only option, correct? In my opinion, not hardly. Do we yet know the adverse effects of masking our children for 8+ hours a day? Do we know if this is developmentally affecting young readers and speakers? Do we know if this is emotionally affecting students of all ages? Do we know how this is socially affecting children? Have we asked teachers how masks affected their students last year? Have we interviewed students to see how masks affected them? We need answers to these questions before signing up our kids for a second year of masks. Aside from that, do they even work? I'm going to read to you a few excerpts from a news article that I will send to you in its entirety when the meeting concludes. Quote, at the end of May, the CDC published a notable large-scale study of COVID transmission in American schools. Here are some findings from the article. Distancing, hybrid models, classroom barriers, HEPA filters, and most notably requiring student masking were each found not to have a statistically significant benefit. In other words, these measures could not be said to be effective. Many of America's peer nations around the world, including the UK, Ireland, Scandinavia, France, and Netherlands, Switzerland, and Italy, have exempted kids with varying age cutoffs from wearing masks in classrooms. Conspicuously, there is no evidence of more outbreaks in schools in those countries relative to schools in the US, where the solid majority of kids wore masks all year long. End quote. Again, I repeat, this study was done by the CDC, the same agency whose guidelines include masking all school-aged children again this year. If data from their own studies isn't being used to make these guidelines, what exactly is being used here? I'm afraid our health department's guidelines are being fueled by the extreme political climate in our state and country. Can some children wear masks all day and not be affected? Probably so. But just like everything else, it's not a one-size-fits-all answer. Not every child can effectively function daily with a mask on. This choice should ultimately be left up to each individual family as they know their own child best. These are our children. Let us decide what calculated risks we are willing to take with them. Please do not let the health department bully you into reversing your decision on masking. Request data, facts, and science to back up what they are advising. You made the correct and fair decision then. Please stand strong in your decision now. And to those of you in this room who decide to mask your child, I am in no way against you. I am not anti-mask. I am just pro-freedom. If the situation was reversed and we were discussing putting in place a policy to not allow your child to mask, I would be up here fighting for your right to choose as well. That's all. Thank you.
You said yes, so you wanted
Me?
to? Yes.
I'm in contacts. I just like you point. I'm gonna be a little unorthodox, many of you know me, and I'm kind of that way. On August 24th, during testimony on House Bill 248, in front of the State of Ohio Health Committee hearing, Joe Mazzola, who is the current Franklin County Health Commissioner, as well as the President of the Association of Ohio Health Commissioners, provided extremely pertinent information and clarification regarding quarantine, isolation, and the role authority that schools have. I'd like you and our community to hear this testimony, and I would like to provide you with examples of exactly what two of the reps on the House Health Committee spoke about. And I forgot a speaker, but if you'll just bear with me.
Representative Young. Yes, thank you for coming. You just made a comment. Could you clarify the quarantine? You referenced quarantine. Could you reiterate that for me, please?
Through the chair, to Representative. So if a student is vaccinated for COVID-19, and they are exposed to a confirmed case. If they can confirm their vaccination status, they are allowed to return back to the classroom, but they will have to require masking and then monitoring for symptoms.
Follow up, please. Thank you. You're familiar with SB 22, correct? Yeah. Okay. Across Ohio, let me be more specific. In 3 cases, there are 3 different health departments that have 3 different edicts for school districts and businesses. And if your organization is effective, do you communicate standardized approaches to those, or do you just let everybody fly by the seat of their pants?
To the chair, Representative Young. So no, we absolutely strive for consistency across the state when it comes to isolation and quarantine.
Another follow-up, please. And in SB 22, there are specifications for local boards of health. And the term is that the local board of health may only issue a quarantine or isolation order that applies to specific medically diagnosed. And in the Ohio Department of Health's document that shows you the arrows and so on and so forth, vaccinated, unvaccinated, whatever, they don't use that term, and they don't apply that term, and my local board of health does not either. So are you refusing to abide by the law?
To the chair, to the representative. So I'm not entirely sure about the context of your question. Let me back up if I could. So when an individual is potentially exposed to COVID-19 in the school, they are excluded from school. They're not placed in quarantine because that is an official process as it relates to Ohio revised code. So you're absolutely correct. But they are excluded from school, and that is the school's duty to do that. So if a student does present to school, knowing that they should not be there because they are a close contact, the Board of Health does have that authority to issue isolation and quarantine for that individual, or excuse me, quarantine for that individual.
Follow-up. Thank you, Mr. Chair. But isn't the law clear in stating that it's truly up to the school district to make that decision, not yours, not the health districts?
To the chair, to the representative. I'm sorry, the question is?
You had said that the health district will issue the quarantine, and then you referenced the school making that decision. But really, it's really the school board and the school making those decisions, not you, not the health district, correct?
To the chair, to the representative, it is the school districts, yes.
Okay. Thank you, Mr. Chairman.
One more.
And while you're here, that was a personal question from me that in my area,
This is the
just to
vice
ask you,
chair.
we always watched Franklin County last year, and it was one of the hot spots, of course, of the state. And where that authorities rested with our public health and our school boards, I wouldn't say they argued, but there was a lot of deliberation on it. But so could you just talk a little bit about Franklin County, where you really had an epidemic of how you decided who had authorities and controls? What was your calculus for determining that?
To the chair, so we've been very, very fortunate. All local health departments have been very, very fortunate to have very good working relationships with all of our school districts across the state of Ohio. I can speak here in Franklin County. We meet with our superintendents every Tuesday morning. So we had our conference call this morning with all of our superintendents, always providing the best public health guidance that we can at the time that we have it. So that's been our approach, is to have that working relationship with our school superintendents and of course with our school boards as well. So last year, of course, we certainly worked through challenges as we're doing this year. And we continue to advocate at Franklin County Public Health that all of our schools should be requiring masking for K through 12 and for their students and visitors and staff. But we understand that is a decision that is now made by the local school board and the school district.
Thank you. I just think that's such an interesting decision point. The should versus the shall, and who gets that authority. That has been the essence of the public political debate on this for the whole year, from the governor, from the president of the United States on down to the school board. All right, thank you.
So, Senate Bill 22, which is now law, lists the definitions of isolation and quarantine. These can be found on page 16 of Senate Bill 22. Isolation means the separation of one or more individuals who have been medically diagnosed with a communicable or contagious disease from other individuals who have not been medically diagnosed with the disease. Quarantine means the separation or restriction of movement of one or more individuals who have come into direct contact with someone who has been medically diagnosed with a communicable or contagious disease. If you look at this FDH COVID-19 school guidance 21-22 PDF posted on our website, excuse me, it is riddled with omissions of these two key definitions and an open violation of Senate Bill 22, which you just referenced in the video. I will give you just a few examples. On page 2, contact tracing involves identifying people who are likely to get sick because of being in contact with those who have tested positive. Under close contact, also on page 2. The definition of a close contact is someone who was unmasked within 6 feet of a person diagnosed with COVID-19, or was masked and or vaccinated and within 3 feet of a person diagnosed with COVID-19. Again, the statement does not reflect the words medically diagnosed as per Senate Bill 22. Under quarantine, it reads, when you might have been exposed to the virus, quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they may become sick. These people may have been exposed to a disease and do not know it, or they may have the disease but do not show symptoms. Again, Senate Bill 22 states, quarantine means the separation or restriction of movement of one or more individuals who have come into direct contact with someone who has been medically diagnosed. Still on page 2, under isolation, they do the same thing. Moving to page 3, which is a child in person algorithm, that's your blue, I call them mean, but your 2 blue columns. In the first column on the right hand, on the first row on the right hand side, positive or clinical diagnosis. Again, the term medically diagnosed is not used. Page 4, under isolation. Page 5, there are more omissions of the term medically diagnosed. Again, page 6 at the bottom, where they clearly state their definition of isolation and quarantine. Again, it's against Senate Bill 22, which is now law. Page 12, in the flow chart, the DOH will issue guidance regarding who needs to isolate and quarantine. This goes back to the video clip I just played for you where, when pressed, it was ultimately the decision of the local school board. You do have a duty to send home a child who is sick. I'm not saying you shouldn't. Most parents will not send their child home or to school when they're sick. I understand that there are parents who do that, but there's no statute requiring you to send home a healthy child. None. On the page, where is it? On page 5. I think it's page 5 on. Yes. The CDC continues to require that masks be worn on all public transportation, including school buses. I will refer you to Ohio Revised Code that states school buses are not public transportation, number 1. Number 2, the CDC has no authority to mandate at the local level. There was just a court case in Akron. A judicial ruling was handed down earlier this year, and I will get you that judicial opinion in all its 31 pages. In it, the judge clearly states, based on the narrow scope of what our Congress did when they authorized the CDC. I'll get here in a minute, hold on. The CDC, with the approval of the secretary, is authorized to make and enforce such regulations as in his judgment are necessary to prevent the introduction, transmission, or spread of communicable diseases from foreign countries into the states or possessions, or from one state or possession into any other state or possession. For purposes of carrying out and enforcing such regulations, the Secretary may provide for such inspection, fumigation, disinfection, sanitation, pest extermination, destruction of animals or articles found to be so infected or contaminated as to be sources of dangerous infection to human beings, and other measures as his judgment may be necessary. In the judge's ruling earlier this year, it was against a rent moratorium. That judge ruled that that narrow scope of what the Congress authorized through the CARES Act and only, what's the word I'm looking for? Reauthorized it, I believe it was for 30 days, did not cover rent moratorium. The Supreme Court just struck down President Biden's attorney's lawsuit trying to extend an eviction. The CDC has no grounds. Our buses do not go interstate. They are not part of commerce. There are two attorneys, one of which is a former common pleas judge, that have clearly stated they have no authority. These are constitutional lawyers. Number two, Attorney General Yost was also interviewed. His comment was, this may result in litigation. Also, State Rep Ron Ferguson, when this came out, said he was going to speak to the supers in all districts, 12 districts in the 3 counties of the 96th district that he represents, and assure them that the decision can be made at the local level. There are also other school districts in the state of Ohio that have come out, the superintendents and the board, and said, we do not interpret the CDC mandate as having any effect on us at the local level. Now, when it comes to masks, and I will also provide you with the legal documentation for what I'm about to say. If you're going to continue to mandate masks on the bus or decide to mandate masks in school, you should know that face masks are emergency use authorized only for the general public. They are not emergency use authorized in surgical settings, medical settings, hospital, or health settings. This was done in a letter dated April 24th, 2020 by the Food and Drug Administration and stated that authorized face masks must be labeled accurately and may not be labeled in a way that misrepresents the product's intended use as a source control to prevent the spread of SARS-CoV-2. The letter specifies that the labeling may not state or imply that the product is intended for antimicrobial or antiviral protection or related uses, or is for use such as infection prevention or reduction. If you go into any of the stores that sell face masks, in order for them to import and sell them here in the US, they have to clearly have that disclaimer on there because they have not been FDA approved for public use to prevent SARS-CoV transmission. Also, any EUA mandate requiring individuals to wear face masks conflicts with federal law. With section 360BB-3, and I'll get that to you, which provides that the person must be informed of the option to refuse to wear the device. Title 21 of the Federal Food, Drug, and Cosmetic Act states, individuals to whom the product is administered are informed, 1, that the Secretary has authorized the emergency use of the product, 2, of the significant known and potential benefits and risks of such use, and of the extent to which such benefits and risks are unknown, and 3, of the option to accept or refuse administration of the product, of the consequences, if any, of refusing administration of the product, and of the alternatives to the product that are available, and of their benefits and risks. In a nutshell, if you're going to mandate masks at any point because they are emergency use authorized only, you need to inform every employee, staff, parent, and students who are not of minor age of their federal rights. It's called informed consent. Also, I'm going to ask you, as a mother, when you guys decided to impose and mandate masks on the school bus, you not only took away my right as a parent to decide what is best for my child, you also took the right away from yourselves. That is not right. When you decided based on an insurance company coming to you and saying, there's an elevated risk, we could face a lawsuit. And I'm going to be kind in saying I understand a knee-jerk emergency reaction. Your job is to ensure that this school is fiscally stable. We have struggled in Amanda for a long time. It took us how many times to get a levy passed? We fought and fought and fought for it, right? What you did was you then put money above what is right for our children and what is our God-given right as parents to decide. When you did that, you are no better than the state assembly that sits there with legislation that can protect all of us. It was almost like it's all about money. Money's important, but what's more important? Our right to raise our kids the way we choose, our right to decide whether or not I want to put my kid or any parent wants to put their child in a mask. I'm not anti-mask. I'm not anti-anything, but you have a duty to preserve not only my right as a parent, but yours as well, or grandparents. When you did that, you not only let my child down, you let your own down. Because you should have stood up and done what was right as a parent and a board member. So I urge you, if and when it comes to it, and you decide to determine whether or not to put masks on our children or mandate them, keep in mind, first and foremost, we were given these children for a reason. It is our job to protect them. The government didn't bear those children. The government's not raising them. The insurance company sure as heck doesn't have any right to dictate what I do with my child. And I will go one step further. If the insurance company is willing to come to you and say, if you don't put masks on these children, we may not cover you in ensuing litigation. Do not think for a moment that they will not come down the pike later and say, if you don't mandate that vaccine, you're gonna have a problem with your insurance. Because they're doing it now. I called my eye doctor today, Friday, and said, I need an appointment, need my eyes checked. Are you requiring masks? No, not as long as you have a vaccine. They're being mandated everywhere. At some point, somebody needs to take a stand and say enough is enough. These are our kids. And I'm asking you to do that.
Thank you, Heather. Micah?
Me? Well, I'd like to start off by saying I feel kind of sorry for you guys. I'm all times to be on the school board, right? During this COVID mess, that's got to be one of the most challenging things for you. Challenging times to be on a school board, right? So many decisions to make, and you're probably getting pressure from above and below. Well, I wanted to touch on some things. Heather touched on them briefly. I probably already has, but the first thing is get a little bit more in depth on the buses. The school buses, Administrative rules for school bus construction design, it lists school buses as pupil transportation, not public. Also in Ohio code, any school buses other than transporting students to or from school session or school function may require the school bus owner to obtain approval of the vehicle operator as a commercial motor carrier pursuant to Federal Motor Carrier Safety Administration. So in other words, as long as you're using it for school purposes, it's a school bus. It's not public transportation. This is an Ohio code. There's actually, I didn't know this, there's actually an Ohio Pupil Transportation Operation and Safety Rules section. So it's literally pupils, it's not public. If you hear that anywhere, they're lying. So it's absolutely that way. And there's some other school districts, I should have got a couple off the list. Other school districts are the same as Amanda right now. Some are making kids wear masks on the bus and allowing them not to wear masks in schools. Other ones completely, they don't recognize the whole public transportation thing. That they consider them school transportation only. What else do you want to touch on? Oh yeah, the insurance company. Am I allowed to ask you guys questions? Or is that
I don't
part
think
of
there's
protocol?
I don't think there's a prohibition, but in the interest of time,
Okay.
I would say probably, if you want to email them and then we can research and get you a better response.
Okay, well, this is something you may have your lawyers look into. Ohio Revised Code, liability insurance indemnification. I think you may have some liability and some liability protection in law. So you might, I can send that to you, you can look into that. Are you aware that the NIH director admitted the school mask mandates are not based on data? The NIH director, is any of you aware of that? The only reason why they recommend them is because of quarantine and disruption at school, which I think we all know is a bad idea. Hold on a second. She touched on some things I don't want to go over the same stuff here. Are you familiar with ACEs? Anyone?
What does it stand for?
ACEs is adverse childhood experiences. This is from, if I can get to the page. Oh my gosh, I don't know how to turn up somewhere. Adverse childhood experiences are potentially traumatic events that occur in childhood. ACEs are linked to chronic health problems and mental illness and substance abuse problems in adulthood. 1 in 5 kids living in the U.S. shows signs or symptoms of a mental health disorder in a given year. I'm skipping over some parts here. The average child spends 6 hours a day in school. This means that schools have a role in helping address mental health for all students. Signs of the ACE, excessive worrying or fear, feeling sad or low, confused thinkings, problems concentrating and learning, inability to carry out daily activities, intense fear of weight gain or concern with appearance, symptoms, school changes in school performance, excessive worry or anxiety, hyperactive behavior, frequent nightmares, frequent disobedience or aggression. Says here, preventing ACEs could potentially reduce a large number of health conditions in future. This is from, let me go find this here. This is from the CDC, I believe. ACEs, this is the scary part, and this is why the last year and a half has been horrible on children. ACEs can have lasting negative effects on health, well-being, as well as life opportunities such as education and job potential. These experiences can increase the risk of injury, STDs, maternal and child health problems, including teen pregnancy, pregnancy complications, and fetal death. Children growing up with toxic stress may have difficulty forming healthy, stable relationships. They may also have unstable work histories as adults and struggle with finances. So, long story short, these are actual studies, and we think, well, it's just 2 weeks to flatten the curve, 18 months to go through all this. They're resilient, they'll get through, it's just a mask, it's not a big deal, right? I mean, really, it's a big deal. Wear a mask on the bus for 20, half hour, that's not gonna kill them. I'm sure people back in the Depression
You know, the kids back then, they grew up fine, many to be great leaders. But what we don't know is many of those people probably grew up with mental health disorders and other things that only their closest family would ever know about, right? So every kid we do that to now has the potential to not only affect them right now, but later in life when they get older with actual disease. There's studies that prove that. So when you're thinking about masking a child in a bus 90-some degrees out, and especially the ones that are scared of them, right? They can't breathe in them. Think about, it isn't just today you're worried about, well, you get through it, it's just, a few weeks. Could be for the rest of their life. Because to them, it could be very traumatic. And there's no way you can tell which kids it's gonna affect and which ones it's not. So I would advise that you keep that in mind. And then I wanted to, real quick, touch on, I don't want this to get uncomfortable, but, because I respect what you guys do, I know that I'm not in a position. You guys ran for board, superintendent of the school, lots of responsibilities. I respect that. But when you made the policy to have no masks, right?
No,
You made a policy back in July for no masks.
no, we had the policy that says mask was optional.
Yeah, mask optional. I'm sorry, my apologies. Yeah, words do matter, right?
I told you.
So masks were optional. When that changed on Friday, the insurance company, whoever done that, I have no idea how that came about, but the last minute right before school started, the policy changed, or did it, because the policy didn't actually change. What was sent out was a last minute letter telling, oh, sorry, you gotta wear a mask on the bus now. We didn't vote on it. We didn't change the policy, but you gotta wear masks. So that being said, last thing I wanna say is that policy that you originally voted on kind of needs to go back into effect. The only way you can actually do it legally is if you vote on it and vote to make masks mandatory on bus, because you guys kind of skipped that part. And I appreciate the fact that it was, like Heather said, it's a last minute thing, threw everybody for a loop. But it's not just the school, lawsuits, it's people's lives and kids, their futures. There's a lot riding on this. And the last thing I'd like to say, I don't know what I would do if I was on the school board, to tell you the truth, but I know one thing I would do. I would look into everything you can. Do not count on anyone, your lawyers, anyone to give you all the information, because they're not gonna do it. Orders just coming from the top down, and they're expecting you to follow them. Like she's even said the word mandate when it comes to CDC. It's not a mandate. They didn't mandate anything. It's just guidance. They cannot mandate anything. But I've seen that on other school boards' websites. Washington Courthouse, they listed as CDC mandate. It's not. But if you don't look into those things, you're not gonna know. And I would recommend that if you don't have time, because we have jobs, we're trying to look up information when we can when we're home. If you have jobs, you got the job here, get some other counsel to help you. Reach out. I don't know if are you guys allowed to do that, or have another set of attorneys that can help you with just specifically COVID-related issues?
Like a second opinion?
Yes.
We can do whatever we're willing to pay for.
Is there money that's available from the state to do that?
There's nothing, I mean, it's general fund dollars, what it comes down to.
Well, I would
Not saying
recommend,
that's not
But,
important.
yeah, we have other,
I'm just saying, we can talk to as many legal people as we want to, as long as every time we talk to somebody, it's.
right, well, I just meant that if you know what's best for the kids, which is not masking them, quarantining them, and disrupting their school year, find somebody that can help you with that problem. If you don't have time to do it, which we don't even have that much time, then reach out to somebody. If you don't, then you're flying blind. You're just going by what your lawyers are saying. And what we found is you would think, actually, she just talked to the health director in Fairfield County. She went to talk to him. Do you guys know what cycle thresholds are? Right, neither did he. He's the one making policy, correct? So the guy making policy for our county doesn't even know what a cycle threshold is. So even he needs to seek somebody else, because which is understandable, he's in the administration. He's hired because he's good at administrating things, right? He's not hired because he knows all the technicalities of everything. But the problem is he's making policy without knowing everything he should needs to know. So I recommend you guys seek some outside counsel to help with COVID. Thank you.
Last person who said they'd like to participate is John, I think it's Weaver.
Is that messy handwriting? Hi, John Weaver. Have two high schoolers. Been in the district since they were in kindergarten in 2003. I'm a physician. I'm an anesthesiologist at Fairfield Medical Center and was one of the physicians that when the Fairfield Department of Health guidelines came out last fall, immediately showed that to colleagues and at the hospital. And I think you all remember the letter that was generated with probably 50 to 70 physicians to sign it, saying that these policies are overreaching, not necessarily based in truth. And I think it probably helped our kids be in school instead of being at home all the time, and have a somewhat normal school year last year. I wasn't planning on saying anything. I was just planning on coming to the meeting and listening. But when I saw this on the desk, I said, oh, I better sign up. I want to say something. So I had nothing planned. Again, I find it, when it came out on Thursday, showed it to my same colleagues at the hospital, and it was kind of a here we go again type of reaction. But, we're pretty tired, and the gusto to do the letter and it's just not there right now. But there's some significant overreaching things in here in terms of what the Fairfield Department of Health defines as a close contact. That's all I want to say is that it is guidance. It's not like the Fairfield Department of Health is a bunch of committee of physicians that have studied the latest and we sit around and talk about it. We're not involved with the Fairfield Department of Health at all, which is why you had the letter last year that was signed by all the critical care doctors, the pediatricians, the OBGYNs, the anesthesiologists, the people that are taking care of the people with COVID in the hospital, that wrote the letter and signed the letter due to the overextension of what was in that. And there was if I do believe, a retraction of certain things that were headed in a direction that was a little bit more reasonable. So again, it's guidance. I'm not aware of all that's going on with lawyers and masks, and I haven't been made aware. That's something I haven't been kept up. I'm not up on. I'd be interested to hear what all that's about. But my thing on this is just the arbitrary things in terms of what this Fairfield guidance is saying as a close contact. And that's it. And I'll be available if, I don't know if I'm not allowed to speak anymore, but if there's questions and there's a medical person here, let me know. You want me to answer something?
Okay. That's all I have signed up. I appreciate everyone's opinions. I'll just say the fun, I say fun, of course, facetiously, fun part about this whole issue is I experienced a microcosm today because my daughter got sent home quarantined. My senior got sent home quarantine on Friday. And she got sent home quarantine once last year too. And in order to get out of the quarantine, she had to go test negative. And so last year I took her and she did a rapid test at Kroger. They gave her a rapid test, and within like a half hour came back negative. So we knew she'd come back. So she went and get a test today, and they told her, well, you're not showing symptoms, so rapid test doesn't work. You got to get this long. It's like, what's rapid test worked last year. So that's the issue. I mean, I understand where everybody's coming from. The issue is, it seems like if you talk to this person, you get this answer. If you talk to this person, you get this answer. You talk to this person, you get this answer. You talk to this. And that's the challenge we tend to fall in with this thing. Depends on the day and which direction the coin flip goes. I think is where some of the decisions end up coming, or some of the information you get. So anyways, I'll just say that as a little example of kind of what's going on. But I know you two called. Was there something you wanted to bring up initially first, or?
No, listen, I think just in general, for me, I think the board needs to be briefed on how the events of the last 5 days in school have happened. And listen, this is not for the staff. I know you all are trying to manage this the absolute best you can, so there were no accusations being thrown around, but I think things happened very quickly when the Department of Health pushed down this new guidance. And from my standpoint and observation, we are implementing COVID protocols that the board did not pass in our summer months leading up to the school year. And so I understand there's a difficult decision to be made at the moment when you're handed these new guidelines and you have to make a decision about what's going on. But at the same time, I think the board needs to get our heads around, what's happening in the school, what kind of conversations have happened between the district and the Department of Health. Because I kind of feel like we've been kind of bullied into this process. And the result has been, one, parents did not have an understanding about, what the consequences are going to be if they're sending their kids without a mask, right? So we have this issue where I don't feel like parents are properly informed and given, because the guidance came out after we'd even started the school year. So, but we got to do a better job of one, helping them understand what that situation is. And then two, getting our heads around, are our hands completely tied here? I don't personally believe they are. I do believe that this is guidance from, the county health department, but if you all have received information to the contrary, then I think we need to know that and take into account how we adjust our policies. But I mean, if we're speaking technically right now in terms of what we approved at the July meeting, that's not what we're executing right now in the building. And so we have to get on top of it. So that's kind of why I wanted to call the meeting and talk to Mrs. Young about it a little bit. She agreed. So, some of the things I'm interested in is, again, how this whole was there any dialogue with the Department of Health when the guidance came out? And I'm interested in some of the things, just to better understand what's going on in the buildings, right? So where are we seeing the greatest number of exposures? What are we doing from a spacing standpoint to try and mitigate the mass quarantining? Obviously, there's very little we can do if we're going to go by this Department of Health guidance, because basically they say if one person gets it in the classroom, the entire classroom has to go home, which I quite frankly think is ridiculous.
Amen to that.
We meet, the county superintendents meet weekly with the county health department. We've questioned many of these things, including the part about us being able to quarantine healthy children that have been exposed. I guess I don't like the answer of what we've always done, but we have not varied from what the Fairfield County Health Department has asked us to do since March of 2020. We have fallen in line with what they've asked. So when they brought this down, I proceeded to go forward with it because that is, because I will tell you, as we all know, policies and mandates, requirements were changing dramatically last year. We did not meet and change the policy every time that we got something handed down to us. I was given the authority to make that change. I was never not given that authority to make that change. However, the question brought up about tonight, and this is where a school district in this county is about mandating quarantining students who are healthy and have been exposed, and they have decided not to. I asked today for the county to give me their numbers of quarantine. That district has, I think, 2, and that's the cases of kids who have actually been diagnosed with COVID. So I will tell you this. I told you this since I've ever taken this job. I'll go up the hill, but when I turn around, I want to see 10 eyeballs right behind me. I don't want to see an 8, I want to see 6. I want to see all 10 of you right behind me, because what we're about to do is we're going to go away from what the health department, and everybody can talk about legal services and mandates and insurance companies and everything else. Don't think for a second that I went out and made this decision without talking to the legal, without talking to our liability insurance carrier. Those decisions were made with input from those companies. But when I do believe, I've been asked it the last 3 days, but I do believe our administrators have followed the letter of the law in regards to what was handed down.
to answer the question about how quarantines came to be. If there's something different that we need to do, then,
No, I totally think they follow what was given. I know with my specific case, I know Sarah's like, hey, they showed me the diagram of who needed to be quarantined based on the room and 6 feet, I mean, which is the diagram we got, so.
and then it talks
So, yeah,
about
as far as I know, it's all been done as was handed down to us, so.
the whole classroom issue is, when they talk to 15 minutes accumulated time, whether you have the mask on or not, determining whether that kid was with someone from the corner of the room from the time they got here at 8 o'clock and left at 2 o'clock. Would there have been a time where we can keep track of that time? So it's very, very difficult in order to do that.
That's, I mean, honestly, Mr. Dick, that's part of my concern. And quite frankly, I know the stress it's putting on the administrative leadership team as we're going back and trying to figure out and account for every minute that someone's closer than 6 feet. And every minute we're doing that contact tracing on behalf of, quite frankly, the Department of Health, whose job is to do. It's not our team's to do. And I said that over the summer. It's a minute taken away from the job they're actually hired to do here. That's for our kids. So, you know, I'm equally as concerned about the stress and strain it's putting on our staff as it is the stress and strain it's putting on parents and kids who are having to account for, you know, whole classrooms of kids going home for 7 days.
And let's be honest, we're not medical professionals. Well, I take that back. I apologize. We do have some medical professionals on the board. I'm really sorry, Robin. We do have a medical professional on the board. But even the Department of Health is not stocked with medical professionals, right? 3 of the 5 are not.
You have
And-
one physician on that board.
And so, you know, I think that's something worth, you know, noting. But the other thing is, when I look at this stuff, 3 feet versus 6 feet, indoors versus outdoors, 15 minutes versus 16 minutes. Where is the data that shows that 16th minute is the one that gets you? Where is that data that says you're okay at 5 feet 11 inches, but when you hit 6 feet, you're toast? Because let's face it, we're playing Russian roulette here, I think, and I've gotten to the point now where I'm like, I'm just, I mean, personally, I'm tired of this. And I do feel like the Department of Health waited specifically on purpose until after school started to release this. I feel like, you know, it's not like the school year snuck up on them. It was calculated, and I think it was done on purpose that way. And I kudos to you, Mr. Dick, for I know you've never made a decision in a vacuum. You've always consulted multiple people, including our legal team and staff, and you're very good at communicating with us. I think the issue isn't necessarily within the 4 walls, so to speak, of this building. I think the issue is somewhere else, whether it be with, you know, Fairfield County Department of Health, ODH, whatever. But the other thing that really doesn't sit well with me is they've given no discrete criteria for when this will stop. And I don't know if anybody's been watching the news lately, but after 20 years in Afghanistan, I think we can safely say not having an exit plan is a little bit of a problem. And so I think not having any discrete criteria that they can say, well, when we reach these numbers, we'll stop the masking or the quarantining or whatever the recommendation of the day might be. So I don't, sorry. I know that was more of a commentary than anything, but since we can't say it, you know, in an email to each other, this is our opportunity. And the question was brought up, why are we having this meeting? And you know, one of the reasons is because of sunshine laws, we're not able to discuss things as a group, as a board, in private, right? So, you know, if we want to call one person, we can do that. But if we want to discuss it and share our thoughts as a group, this is our only means and method to do so. And at the same time, to get feedback. And it's nothing against social media, but it's real easy for someone to pick up a phone or type away on a keyboard and give you their thoughts. It's totally different when somebody takes the time to show up. So kudos to every single one of you who are in here tonight. Thank you for showing up, because the fact that you found a babysitter or gave up, you know, watching whatever it was on TV or whatever it was that you had to go do tonight. The fact that you gave it up and you showed up here, I think speaks volumes.
I like to put Dr. Weaver on the spot.
Okay.
He said he would offer, so we're going to take him up on his offer. I have very strong professional opinions about it, but some of those are biased on my own personal experiences. I mean, what are your thoughts on the masking versus the no masking, the data you've read? I know you're right in the heart of it and taking care of doing anesthesia on patients with airways that have COVID or potential COVID, and just kind of give us an overall.
Thanks, Rob.
Yeah.
Well, you know, the physicians that signed the letter last year,
Yeah.
that sort of, you know, I don't have that letter memorized, but they were on both sides of the political spectrum, people that
Yes.
don't see eye to eye in the doctor's lounge.
No,
Normally are arguing, you know, friendly arguing about things.
Absolutely.
That was a 50-50 letter. That was not a political letter. And, you know, really, if, and I've said this, at this point, you know, who are we protecting? So, you know, everyone's had an opportunity, and the 1 through 12-year-olds right now, right, we can't get them vaccinated yet. You know, I guess one thing to consider would be that probably, but you know, the vaccine has not been required yet at Fairfield Medical Center, but we've strongly urged it. And that strong urging didn't really change the percentage of people that are vaccinated or unvaccinated. I think everyone has either made their decision at this point. And so, you know, really, if I were concerned about my kid getting COVID or a person who's not vaccinated getting COVID, then they should wear an N95 mask.
Yeah.
Okay. And because that would protect, you know, my parents come to athletic events, they walk around in the crowd, they wear their N95 because my mom is an at-risk person. They've been vaccinated, but she's at risk. So they wear their N95s. If there's no one sitting around them, they take them off at the games. And if you've been vaccinated, then you have less to worry about. So it comes, at this point, it's who are we protecting? And if you've been vaccinated, great. And if you're really concerned about your kid getting it or you getting it and you have been vaccinated, I would urge you to wear an N95 when you're around other people. The other thing is, again, that this is just guidance. There's some overreaches in here when it talks about the athletic and sports, when it says where did it say? The risk of spread increases the more an athlete interacts. Any individual engaging in a contact sport with a case for any amount of time. So any amount of time is 1 second, 2 seconds. I'm not even sure, you know, any of that. That was one thing that we, as a group of physicians at FMC, what are you talking about? Any amount of time?
Mm-hmm.
And so again, it's guidance. You know, there was guidance that was put out last year, and a majority of physicians at FMC spoke out, you know, with different opinions. And, you know, the Fairfield Department of Health is not a group of medical experts from all over the place making these, writing these policies. What other questions?
Well,
Yeah.
I guess part of my concern with this is I think these exclusion policies, quarantine, don't come to school, are stricter this year than they were last year. And they almost negated the fact for people who have gotten the vaccine.
Right.
Some of them, it's kind of like, well, you've got the vaccine, but I still want you to wear a mask and I want you to do this and that.
But last year we were masked all the time.
I'm sorry.
But last year we were masked the entire time.
Right.
So
Right,
that's,
right.
And the online option is not, we're not doing that.
well,
For K5, you are correct, sir. Yeah, there's no option for online for
to bounce around. Like last year, I remember we kind of,
Yeah.
you got sent, you know.
There's no for K-12, or no K-12 online.
Right.
We have an academy that students sign up from the very beginning to be a part of. But for us to go to a remote setting, we did not have that option from ODE to do that.
Right, I'm just saying, I remember last year, you know, a kid getting sent home, it just transitioned to the online learning. You press the button and my kids were doing online learning, and then the quarantine was over and they went back to school, and it was kind of back and forth. But this year, if you get quarantined, you're just at home, right?
Well, we still give assignments, because,
Right.
you try to do as best you can to assignments. Again, when this group over here is pulling people out of the classroom to get hold of parents to come get them, I'm not sure we're getting assignments down from up there.
Yeah.
It may happen.
It's not the same.
It's just not as simple as it was in the past.
Mr. Nick, can I speak on that really quick?
Yes.
So, yeah, we do utilize Google Classroom for students and parents, to access, the activities and lessons. However, I think the main difference is last year when we dismissed early, you know, our staff had the opportunity to Google Meet and things like that, whereas now we've gone back to the extended school day.
Right.
So there's not that time, you know, when those students are placed in quarantine, unfortunately.
Right, which is a problem, and it's not, and you shouldn't be expected to have to do that again.
Yes.
So, you know, thank you for, you know, sending a healthy kid home for 10 days and then don't do schoolwork for 10 days. I mean,
My son would actually like to go home for 10 days. My wife would disagree with that though.
I mean, that's a nutshell. Again, either get vaccinated, or if you're worried about getting it, wear an N95.
And just another question, I don't see it in here, but in most guidelines you see, it says this and this unless you're an essential worker. And ours are the loosest guidelines of any, if you're an essential worker in healthcare. Because last year it was, if you had a known exposure, vaccinated or not, you went to work for every scheduled shift. I'm not talking my hospital, I'm talking OSHA said this. Unless and until you had a symptom.
Yes.
And then you were tested, and then until that test came back, you were off of work.
Yes.
Right.
So I struggle with the fact that, and it's not anything we're following these guidelines. I struggle sending a classroom of students home by these guidelines, when yes, they had an exposure, but why aren't we just asking them to mask, then monitor their symptoms, and the minute they have a symptom, they're out? Like, how many students, do we know of any students? I don't even know if you can answer this. Do we know, not names, but do we know people who've been quarantined because they had an exposure? Have any of those tested positive? Do we know that?
Can I answer that question?
Yes.
Yes.
And was their exposure close, or were they in a classroom? When I say are they close, like, are these people who like are friends with each other, friendly, whatever, or are they more a distance type of thing? Without giving anything that would
That's what
say
I'm trying to
anything.
decide.
But again, Mrs. Son, if you read the flow chart, it talks about masks being consistently and correctly worn.
Right.
Which again, that means somebody who's trying to educate kids is trying to keep track of who's wearing the mask correctly and consistently, because consistently then becomes the 15-minute part. So it goes back to, I'm not sure what that educator in that classroom do when they send them down to these people who, once the first phone call made, their day is done.
I think that's the problem, I think, with the efficacy of the mask. Not to pick on you, Mr. Hinton, but I've glanced over a couple times and we weren't 20 minutes into this meeting and you weren't properly wearing your mask. I mean, so to ask, kids in K-5 to do this, and on top of that, to ask our teachers to either, one, ignore it so they can teach their class, or two, to constantly enforce it, either way, is a tremendous disruption in class, right? I mean, I just, the efficacy is the part of the problem. The theory's fine. But
Yeah, and the guidelines don't address how to handle students who've had a COVID positive, right? So
Yes, it does.
if you go, well, is it treated the same as a vaccination? Because it doesn't seem to be according to the flow chart.
There's a 90-day.
90-day period of time.
Yes.
once the
Oh,
student has
is
been-
that, okay.
Yes.
So they're considered vaccinated?
There's 90 days.
Okay. Is that how long my vaccine lasts?
No.
Because I'm just.
Change questions.
Right, I know, and this isn't directed at you,
I know.
Mr. Dick. I'm poking holes in the fact that I can go get a vaccine and I'm supposedly good until, they haven't said when. I'm assuming it's gonna be like the flu and they'll want us to just get it again after a year. But,
Boosters roll out next month.
Yeah, boosters roll out.
okay, so they're not waiting, but yet, if you get or a positive test, then you should be treated no differently, right?
And then HB 244, which goes into effect, I believe, October 13th, you will now be faced with another hiccup, because it specifically prohibits you from discrimination or treating children who have been vaccinated versus those who have not. So that's your next hiccup coming down. You will not be able to treat them different.
Mr. Henton, you look like you were wanting to say something there.
I just, in terms of, I did not receive one discipline referral last year from a teacher who had a refusal of a student, or not one discipline referral of issues with wearing a mask in a class. Our high school students were fantastic, and that's the students were fantastic in that one. I'm not saying it would be the same, a lot has changed. I'm just saying I did not receive one discipline referral. I don't know if very many of us didn't receive one discipline referral a year ago in that. So I don't want to make it, I'm not know whether your intent to make it look like our students would be disobedient to it, because they were very, very good.
And especially, I think, to your point, I think with the older kids, obviously.
Yeah, I can't speak to the young, I'm 9, 12.
Yeah. But I appreciate that.
To me, the biggest issue comes down to, and if you could reiterate what you had said, or where was that? The biggest issue to me comes down to the quarantine issue and what we do or don't have to follow, and just how can we keep kids here in the classroom? Because some people are like, well, if they don't wear a mask, they'll get still in quarantine, but that's not, what is the most consistent way that we can keep kids here in the school?
Make it voluntary.
What's that?
Make the mask voluntary.
Well, that's what they have. That's what they have.
That's the way to do it.
But the issue is, we had how many classrooms at home last week because of quarantine, and a chunk of high school kids and whatever else. And last year, when we had the online option, they transitioned to that, transitioned back. It's not as bad, but at the same time, if you chose to go the one way, you had to stay there for a certain amount of time. And as was pointed out, the teachers had an extra hour at the end of the day because we had a shorter school day that they could work with the kids that were at home. We don't have it this year. We thought, back in this year, we might actually have a little bit more of a normal year this year again. And now here we are.
Can't you just tell the parents, we have this issue, if you want to keep your child home, do it. If you don't, send them to school and let a voluntary quarantine.
Again, in terms of trying to get the kids educated, with the teachers not having the ability and time to work with them at home, then you get into more of a challenge in terms of how can we get people taught the best?
You could go against the PCR test.
It has to be 3 to 5 days after the exposure has taken place.
What I'm saying is the PCR test, I have information I can give you. They did set that PCR test up on COVID. It's CDC documents, I got them right here.
Right.
It's actually just some other essay of, they list a big long thing, but it's not COVID. So the PCR test, which they're doing away with at the end of this year, can't tell the difference between COVID, the common cold, and the flu. So what you could do is insist that if you're gonna quarantine a large group of kids, you want an actual culture done, not just a PCR test. The culture, have them prove that they're actually infected with COVID-19 versus the flu or coronavirus in general.
The FDA did a class 1 recall on certain PCR tests, and that's effective December 31st. And that gives, what it does is it gives those testing sites time to replace them. So if they haven't replaced them and they're still using them, then our children could be tested using PCR tests that have a class 1 FDA recall. That is the highest FDA recall you could get.
So a whole classroom of kids can be sent home because a test that's not actually testing for the coronavirus, COVID-19, says they got COVID.
See, again, I know what you're saying, but I don't know how I'm supposed to combat that directive and go get the next, second test or where the first FDA test was given from. I mean, by the time we get done, we have 10 days anyway.
But in SB 22, the reason they're stating that you guys have local control and decision-making is when they put SB 22 through, they struck out the ultimate authority part of 3701.13. And if you go online and look up S22, you'll see that. Nobody is saying, nobody's asking that you keep any symptomatic or positive children in school. But I agree with you, to send an entire classroom home that is asymptomatic makes no sense. None. There is no statute. Again, there is a statute for you to exclude a child who is symptomatic with an illness, but again, it has to be medically diagnosed. There, and you can double check me on this, there is no statute that says you are responsible for excluding a healthy child. To that point, let the Fairfield County Department of Health do their job. You, in that flow chart, you're supposed to notify them.
We do.
Right? Correct. So when you do that, it is then their job to contact trace, not yours. There's nothing in statute that they can delegate that authority to you. None. You guys are wasting our teachers' times. They need to be educating our kids. Send that information to the Department of Health. Then they do the contact tracing, and then they are the ones that issue the isolation and quarantine orders. They do that based on contact tracing. That's been like that since last year. And again, if you really want to push back.
That has not.
Well, I'm sorry.
It may be in language that never happened that way last year.
Correct. So to your point, the quarantine is clearly defined, the statute clearly defines what is supposed to happen. Tell me that statute is being followed when you have multiple kids in multiple grades in the same household, and one of them has to stay home and the rest go. That is not following statute. But
I'm not saying it didn't happen, but we have given that family directions that they are not to send other children who's in the house with a positive case to school.
Right, but that is the Department of Health's job to do. Your job is to report, I'm sorry.
If the child is positive for COVID and they're sent home, then we ask the other students not to attend as well.
That's correct.
If the child is sent home, student, because they were exposed at school, they're not positive, they were exposed to someone who was. The other students in the household can still come to school, am I correct?
That's correct.
Okay. I just want
Yeah, we're not quarantining exposures to exposures.
Exactly.
Yeah, I was just curious, I wanted to make sure.
At any time that family
And I
member
will
shows
say,
signs of symptoms,
to the credit of our staff and the work that they've done, I do know this: if we send information to the Department of Health that is vague, they are going to do exactly what I would expect them to do, which is to just say, well, you've given me nothing to go off of, so we're going to quarantine that whole class. So the one thing, it pains me that our staff is doing this contact tracing, because as mentioned before, they've got much better things to do. And I'm sure this isn't what they signed up for either. They would much rather be doing something else, I'm sure, right?
Yes, but they would happily do it as long as they know there's
kids get to stay.
Sure, exactly. It's not that, but I'm just saying, like, I doubt anybody takes joy necessarily in sitting down and poring over seating charts and watching film.
Right.
That's not the case. But the thing is by getting down to that level, it does hopefully, by doing that, it keeps from quarantining large populations of kids. So the question I think becomes, or at least it sounds like it's been raised, is, how far are we going to abide by what the Department of Health has given out as a guideline? Because, at the end of the day, we keep following the guidelines or we don't.
The simplest thing to do, if you're looking for an answer, simplest thing to do is send the students who have COVID home, report it to the health department, and then they can do the contact tracing and down there.
That would relieve us of or not the responsibility, but of the fact finding. But I don't know if that's the best solution for our kids, because at the end of the day, that's going to result in the Department of Health saying you all have to quarantine.
And that's.
But they would have to do contact tracing just like we would do. They just can't put a blanket over top of it and say.
Okay.
So would they being the Department of Health, would they come in and go to the teacher? Let's say, for example, I'm thinking of the younger kids that aren't vaccinated. Would they go to the teacher and say, did Johnny sit next to Susie and she didn't have a mask on?
They would probably the 10 days after the kid got back. They don't have time, they're not gonna have time to do it.
So if.
Well, that's what I was going back to.
So they would have to do that. They would have to come in and do the questioning.
To the teacher.
Yes.
To the teacher.
Administrators.
Yeah.
They have the people to do that.
No.
No. So they are gonna do it.
So
No.
that's why I said, if we turn it back to the Department of Health to do, by the time they would maybe get around to it, it would be like 3 weeks later.
Yeah.
If that.
Where their quarantine would have been gone already anyways, so.
Are you sure that you just say, since we don't have time to do it, the whole classroom is out?
So, and that's my question.
Worry about that.
How does it
Can't
get
you
to
say
the
you
point
can't
where
do
we
that
say
without proof?
What's that?
I just don't understand how it went from one kid had it, Johnny had it, to sending the whole class home if there wasn't specific tracing.
Because of the mask.
Because the
15 minutes
mask.
accumulated time.
Okay, so they weren't, so if there were any children in that, and this kind of gets back to the fact that we made it optional for parents. So if that parent chooses to send their kid to school, says, Susie, wear your mask. So then in that case, the contract tracing would say, Susie can stay in school even though the rest of the class went home.
I would say no, because they'll say, well, she ate lunch without a mask. And she ate lunch next to
That's
somebody who was next to
That's where this
somebody.
guidance just goes off the rails. I don't know how
Because
we can ever meet.
excuse me, there's no way we can ever get our kids fed in a timely manner, even the way we're doing the high school, getting everyone fed in a timely manner, sitting 3 to 6 feet apart for every student.
They set us up to fail.
Can I share some information? I've spent a lot of time meeting with people over the past year from the sheriff's office. I've been in meetings with the county prosecutor, the mayor, everyone I could think of. I'm so sorry, Audrey Stinfall. And so I did meet with County Commissioner Joe Ebel last week. And I know he just took over for, I believe it was Larry Cannon was the previous one. And I remember at the emergency county commissioner meeting last November, Larry Hanna was in this meeting and he was saying that his contact tracers are exhausted. He said parents just aren't cooperating with us. We'll tell them their kid has to quarantine and they'll just ignore us. So I'm wondering, what is the enforcement teeth behind this? Because I've called the sheriff's office and asked them, what will happen if I'm told my child has to quarantine, no history of illness, just suspected exposure, and I'm told that my child has to stay home, what will happen? And the sheriff's office said, we're not going to do anything about that, there's no way. So I called the health department and asked them, what is the enforcement teeth behind this? And they said, well, they have to. I said, but if there's nothing backing it up, what's saying they have to? Well, of course they have to. And then it came down to, well, we're hoping that they will cooperate. Maybe they will, we're asking them to. So Commissioner Ebel did follow up with me on some of the questions I asked. He sent me some information, and one of the things he sent me, it says, for asymptomatic persons, when a confirmatory test is negative but epidemiologic linkage criteria is met, the person should follow quarantine protocols for COVID-19. So they are wanting to quarantine people who don't have a positive test and who do not have symptoms, simply that they were, in close proximity to someone who was, tested positive or who is positive. I'm just wondering, where do we stop on this? How far down do we keep taking this?
May I say something also? Judy Steeman. And you're talking also about masks. And the points were brought up, the facts were brought up, really, about how effective are these masks. And they can't even guarantee them, the people that put them out. Yeah, why are we putting masks on people? I'm telling you, it is just, my husband, is a retired teacher, I'm a retired physical therapist. In my retirement years, I also donated time to the hospital. It was absolutely sickening. I'd been there for 10 years, volunteering, playing an instrument. And first of all, it was the staff that had to, they were requiring, have these flu shots. Yeah, mandatory flu shots. And if you didn't get it, then you had to wear masks. Well, I just bowed out during those seasons. And then, lo and behold, this COVID comes around. And you have to, again, mask up and even they were pushing the shots pretty heavily. I have a daughter and I have grandsons that are working there, and they have all taken it. I'm very sickened by the fact that they've taken the jab. I am. I'm very upset. This is dictatorial. And as I was sharing with other people in the meeting, have any of you read The Rise and the Fall of the Third Reich? Hitler himself wanted control of their medical situation. You probably can't even find that book, one person told me. You can't even probably find it if it's 2 years old. Yeah, and I read it back in '63. Telling my age a little bit. Please, the other thing, I know that this is a matter about control, and it's a matter about fear. And I think these are the main things, control and fear. Thank you.
Appreciate your comments. We need to, I guess, bring it into a smaller extent and try to determine what exactly we really want to accomplish here tonight at this point in terms of discussion. To me, again, it seems like whether you agree, disagree with masks, vaccines, or whatever, to me, the biggest issue is the quarantine issue and how can we have somewhat of a normal school year with our kids being in school as much as possible and not having to go back and forth. And so I guess in terms of the quarantine guidelines we were given, how set in stone are those, I guess is where that comes down to. I mean, I almost, to an extent, I like Robin's example with, if we can do it, in terms of if you are exposed to somebody in school, wear a mask for the 7 days. If it shows symptoms, then you go home. But if you're, you don't just send everybody home, right? I don't know, where it comes back to, where we're gonna have to call people, new guy, whatever else is, what are we even able to do?
So is there gonna be an option to have the kids at home if you guys are implement this as well?
As of right now, no.
What's that?
As of right now, no.
And that's not us, that's just.
But if things change, will that option open up?
Not unless ODE allows us to open it up.
Okay.
Yeah, we were permitted by the Ohio Department of Education last year to have both options. This year, for whatever reason, they determined that.
Yeah, the government, once again, in its infinite wisdom, decided to take options away from the districts and parents and tell us in a very narrow fashion what we're allowed to do. which is, I think, case in point, the problem with the
Well,
online.
and I think we all agreed last year, that's the place for our kids, is in the
Right,
school,
yeah.
in front of the teachers.
Yeah, to me, the best place for them
Yes.
is to be here. Absolutely, it's very in person, so it's just a matter of how can we accomplish that.
Can I just say something real quick? My name's Scott Green. This during the 18 months that this COVID baby mama drama has been going on, about 350 kids died of COVID.
Yes.
I don't want any child to die, but it sucks. I got it. This year alone, we're gonna have over 600 kids drowned that are under the age of 6. I'm still bringing my kids to the pool. I'm still bringing them to the lake. We don't even wear life jackets. Honestly, they're in the ass. This COVID stuff, there's too much drama. We're looking for leadership. I think if you just keep everything voluntary, mask voluntary. This quarantine stuff, as you guys are calling, complete BS. Complete BS. We're not sending whole classrooms home kids because someone doesn't even have a symptom. Like, has any child in this school died of this or hospitalized? It's no. This disease doesn't even affect kids, really. There's more things that we need to be worried about that harm our children. Drugs, alcohol abuse.
Yes.
That's an issue. That is an issue. I'm talking, shut your mouth.
No.
All right?
Let's keep it.
No.
Those are real issues. And that's where we should put our attention on. There's more kids that are probably being abused in the school district by bad parents and stuff like that. They're going to legitimately get sick from COVID. Let's prioritize things that actually affect our children negatively. This COVID stuff, let's do the right thing. Mask, voluntary, the school bus, as they spoke, we don't need to worry about it. Thank you.
Okay. I think with that, for the
So
time
where
being.
are we?
Yeah, I would say with that for the time being, I do appreciate
So I know you were
all
looking for
the input and so forth that. we're gonna-
information.
Unless we ask somebody, we're gonna limit the public participation for now. Yeah, it's just fun. And I don't know that we make a decision tonight necessarily.
I would say that it's probably best that we
The
don't make a
plan,
decision.
well, it wasn't even the
tonight.
plan. I think
Yeah.
the plan was just to get here and get thoughts from others, discuss, try to get on the same page of where things are at, and kind of maybe get some idea where we are moving forward. And to me, I guess the main thing moving forward in terms of how we might best make a decision is to, I guess, truly, if there's our legal team or whoever we can ask in terms of the quarantine rules as to what happens if we don't, if we come up with our own quarantine, I don't even say if we want to come up with our own, but what happens if we don't specifically follow this quarantine?
Well, I think we do have Senate Bill 22, quote unquote, on our side in regards to the fact that we are not supposed to be quarantining healthy children who have no symptoms. That conversation has happened several times with Mr. Abel from the county health department when we meet with him. Let me frame this correctly. He is very, very guarded with his decision-making process, with taking a stand in regards to the health department. And follows basically the high department of health guidelines as well. So that's where a lot of that's coming from. And the Senate Bill 22 I think we can, again, I can call our legal advice and there's 37 attorneys up there and they can tell me 36 of them give me a different answer in regards to what our rights are in regards to not quarantining someone who's healthy. And before everybody starts telling me, I understand we're going to create liars and everything else because no one will ever have a sign or symptom of COVID, even though they've been exposed. They'll be taught not to say it. So that comes into play as well. But, and I do believe that's probably one of the reasons that, that's happened is that K-5 kids, I'm not sure how dependent they are in regards to, did you have a mask on all the time? Do you feel sick? Do you have this? So, and to the health department's point, I'm not sure they're any busier than we are in regards to the contact tracing piece. I can guarantee you, they're not. I only have one COVID coordinator here, so.
Yeah. And it stands to reason that the health department's gonna be risk averse, and I can almost guarantee you, while you'll probably get 37 different answers from the legal team, they're all gonna err on the side of caution and say, avert your risk of litigation by following every protocol you can. That way you can, use plausible deniability at any point. And
You're assuming a lot. I mean, hopefully our legal counsel.
yeah, I mean, I've been let down a lot in the past, so maybe that's, but you're right. There might be some that would
That's
say.
the reason you ask for legal counsel.
Sure.
So that they can make it.
We did ask for the buses, and they gave us that very well-played answer. And to that end, I would, if there one thing does come out of tonight, I would like to say, I'd like to have a motion put on the next meeting's agenda to have whatever we do on the buses mirror what we do in the school building. And there's two reasons for that. One, it's, I think it is in line with our current policies, which are basically the rules that apply in the building also apply on the bus, for good reason. And two, I just do not see the benefit whatsoever in having kids wear the masks on the buses if we're not gonna turn around and have them wear them in the school building. And I don't think there's any benefit, whether it be from preventing transmission or otherwise, to doing it. So I would like to, if I need to make a motion, and if someone needs to second it, I will move to. Okay,
So we can just
that's
put something
fine.
on the
I'm
agenda.
just saying, whatever I have to
Discuss
do,
it then.
I would like to put that on the agenda for the meeting on.
I think to answer the question though about the school bus percent of the crowd, we were told by, the CDC came out and said public transportation, that they were considering school buses to fall under that. That's why we went with that. Am I correct?
That's correct, and then
There wasn't-
our legal advice, ORC refers to interstate traffic in certain regards to, from what I got, from motor size and all this size, but when it came to public transportation, our kids are public, they put on a bus, so it's considered public transportation, and that's how that came to be.
So we did listen to our
Yep.
legal counsel. That's their profession.
And again, we have not randomly not followed legal advice.
Right, yeah. No, I don't think anybody's making that assertion whatsoever.
Well, the other element of that issue too is, I disagree with comments that were made earlier, that it's not about money, it's about compliance with another state law that says we have to be insured and have insurance carrier covering our vehicles while we're moving kids to school. So it's not about the cost of the insurance, it's about being covered or not being covered. But I know there are other school districts in the state who are being covered by someone who continues to cover them even though they're refusing to do this. So, if our insurance carrier wants to push this issue with us, then maybe we ought to be shopping around and looking at some of these other districts. I mean, if we want to go there and we want to be able to do this, we need to start talking to some of these other school districts who are doing it and find out who's covering this from an insurance standpoint so that we don't have that threat hanging over our head. Because we do have to be in compliance with the law in that regard. I mean, to me, that's more of the issue.
They did clarify too, that it's not that they would drop our coverage completely. It's just that they would not cover us in the instance that we had litigation arising from transmission on the bus.
Right.
Which, how you would prove that, I would have no idea, especially when they're getting to school and taking it off.
Right.
So show me how you prove that. And I'm willing personally to bear that. And I'm just saying we need to mirror, whatever we're doing on the buses needs to mirror what we're doing in the school. And if things evolve and they change, it'll make it that much easier to say what we do in school applies to the buses as well. Because that's how it's been, and I understand why.
Sure. My only point is we just have to make sure we're in compliance with this other law over here that says we have to have, up-to-date insurance coverage, so.
And Mr. Dick, do you have a I haven't heard lately, but other schools in the county, we're not the last holdout to not mandate masks, are we?
No.
Has anybody in the county mandated masks all the time, or are they mostly just doing the bus?
I do believe Lancaster is full-time, Dickinson is full-time.
Masks now? Okay.
I've talked to all of them today. I won't divulge their stance, but I mean, it's a discussion point at all other 6 locals.
Are all the other, districts, and I know you're talking in general, are they, complying with the sending entire class? Are they also sending entire classes home?
Except for the one district, yes.
Okay.
What's the one district doing?
He doesn't want to demolish one.
They're sending
what
kids
they're doing, yeah, not
They have
what
COVID, they go home.
But what about
The
the,
tracing part, they send it to the health department and
Okay.
that's in our county? And they're not a school that masks.
no, they're not.
I would be shocked if they were.
There's one that is, that's what I'm asking. Not that I want to be a leader or a follower by any means, I'm just curious as to what the other districts are doing in our county.
Well, I will tell you, I don't know, I know everybody's got the same goal in mind, the same end game. I can sit here and tell you, and this is no offense to that leadership team over there, or the leadership team that sat there last year. We're going on 2 years of, there's virtually been no instructional leadership allowed to happen by those 4 people over there because of this. And I'm not trying to find the easy way out. I'm not trying to make their life easier, because I'm sure as soon as we change something, we'll get 47 kinds of H about that as well. That will create more issues for them. But I will tell you this creates a very, very difficult leadership part to try to lead in a setting that we're leading right now, and trying to make sure that kids are still learning. And I commend our staff, I commend them to do it, because it's not been easy. And I think the reason I get a little frustrated is all I heard was what a great job you all did last year, but yet we haven't changed anything in regards to following, and all of a sudden we're not doing a great job. So I don't know why that is. So that's the frustrating part on my part, is that we can change things, and you'll have this many people sitting in the room again a month now who's not happy about the changes we made. So
What's going on the last 7 days is not sustainable. I mean, in my opinion, it's just not sustainable. But you can't keep up that pace and have your administrative team actually doing the job that they're hired to do.
No.
I mean, it's just,
That's what I'm getting.
no way around it.
We'll either need to try to figure out, something different with the quarantine rules, if we're even able to do that, or we'll.
if any of you are thinking that the health department of Fairfield County is going to give you any guidance and help and support, it's not going to happen. So just make that mindset right now.
Yeah, no, minimal. And when they have, we've had to fight against it last year, because I know there were multiple calls when they had their guidelines put out last year, and the phone calls made, and then y'all put that letter together, and that helped a lot in terms of our ability to keep kids in classrooms.
So we have, I mean, what's the action coming out of this meeting? Because we've got more than 2 weeks before our next board meeting. I mean,
We have 1 week.
This is a week from
oh, it's a week from now.
Yeah, a week from
Okay, so another week.
What do you want me to bring back to the 8th?
I think there definitely needs to be some discussion with the legal team, legal folks about
Senate 22?
the quarantine rules. Yeah, and what happens if we don't follow them to the letter, I guess. I mean, there are some aspects,
I think we need to be careful using the word rules.
quarantine guidelines.
Yeah, because that's really what they are, they're guidelines. But I understand what you're saying too, if you don't follow the guidelines, you open yourself up with another can of worms. But I think we need to get used to using the word guidelines. Because when we say rules, that makes people who are listening, and when it goes into the minutes, think that we would be violating a rule when we're really not.
Right.
We're questioning a guidance.
Yeah,
That's what it
questioning the
says.
guidance.
It's guidance.
Can I ask a question, like right now, on
Big
our
difference.
entire classrooms that have been sent home? Is that based on a direct, we have went back and accounted for every single student has had close contact with the student who's positive for more than 15 minutes, or are we just utilizing the Department of Health's blanket guidance there with their little diagram that says if you have one student in a classroom, then we're just sending the entire classroom home?
Principal, you want to answer that question? Because
I will answer that question. So Mr. Sharp made reference to his daughter. So when I receive positive cases, the first thing I do is Mrs. Filiopoulos, high school secretary, will pull the student's class schedule. Our teachers are mandated to have their seating charts on hand. At that point, we look through the student's schedule, positive case. And a positive case, depending on the health department, you have to contact trace 48 hours prior. So take, for example, the 4 we got on Friday. So you go back 48 hours from that. And you look at their class schedule, look at the seating charts. Our teaching staff has done a great job of making sure that our desks are as far apart as possible. We don't have as many students online last year. Many times we had over 100 students remote learning, so we had more distances in the classrooms. At that point, we look through seating charts. We go around to the different classrooms. Mr. Rosich today gave me a hand, and we go through, and because they're not to scale, and we ensure how far apart the seats are. I will say Friday, measuring tapes, and we do that to make sure I think it needs to be known, in fairness to these 4 here, that it is very much studied in this, that every student is careful consideration by these guidelines that are given to us, that nobody's going home unnecessarily or that does not follow this guideline. There is a lot of discussion. There is a lot of debate. There is a lot of care and worry into everything that is gone. So that process, and that once that happens, also you have to look at the lunch location, watching cameras in the cafeteria, where they are, and those things. Did the student wear a mask in class? Those things are different this year because some students are wearing them. I'm seeing a huge influx in high school students the last few days wearing them. Is the student vaccinated? So we can't ask them directly, so we have to go through the scenarios with them because they identify it themselves if they're vaccinated or not. So there's a lot, and then it comes down to, we start to contact parents, notifying Ms. Leist, the school nurse, about these things, and we start to go through the parents about the 10-day quarantine, being able to be tested after 5 and returning after 7 with a negative test.
But I guess my question though.
So there's not a whole classroom.
Okay. It's everywhere they travel, anybody that was within 6 feet of them.
Not everything they travel in the class in a setting, because number one, this is why we set up the schedule the way we did last year, and we've kind of continued it this year, is because many schools, just take Circleville, for example, they have 9 periods of 39 minutes. This is why our block scheduling is helpful, because we do limit the amount of exposures our students have by going to only a few periods. So we do limit those. There are some things in our day that reduces our numbers down.
Right. What about the elementary?
So the elementary situation was, information was given to us. Mrs. Lice told me that the health department told us to quarantine the entire classroom. So what we did that day was we called all parents and we quarantined that classroom. Then the next day, this guidance came out that cleared up the mud a little bit. So what we did was we went through that, and that was 4 or 5 readings that evening on Thursday night. Went back with that and discussed, we can get these kids back. So we got half the class back based off their locations in the classroom, based off locations in the bus, and location in the cafeteria. So we got 19 kids back. So we only have currently 18 students quarantined, with 9 of them returning tomorrow because our quarantine is over.
And Mrs. Freeland.
And then in the primary, so ultimately we had to quarantine 1 class so far, and then we readjust, kind of like we always do. We hear something, we get better at it. So now we're able to chunk kids, is the best way, I guess, to say it. So the same kids are eating at lunch together, the same kids are sitting together at art. So ultimately, our goal was to limit the quarantine. So instead of 25 kids going home, maybe only 4 kids need to quarantine. So that's compliments and kudos to our staff for number one, saying, okay, well, what about this location? What about at lunch? What about NARD? And then adjusting and working together to try to come up with solutions. Another thing we did is kind of tweaked our recess a little bit to stay under that 15-minute mark and then offer an additional recess if kids need a break in the afternoon. So ultimately, like I said, just reducing the size of quarantine. And what I told my staff is every time we maybe have to quarantine kiddos, we want it to be less every time because we're getting better at it and more effective. So that's our ultimate goal.
Well, we appreciate
Yes.
all of your efforts and that you have
I
to
don't know,
think
Mr.
about.
Rick, if you're the one to ask. So I know there's a fair amount of students who are and are not vaccinated. So is there a place that a parent, if their student is vaccinated, so that you don't have to go through every time and ask that student? Like, is there a protocol where they should, if they chose to disclose that to you?
We have talked about that, and what we are having is, when we have spoken to several students here in the since Friday and Monday,
Because I know you need proof of vaccination.
correct. So
Absolutely.
we have that conversation. If the student identifies that they have been vaccinated, again, that's their own willingness
Right.
to identify that. If they identify that and they do provide that proof to us, they email myself or Mrs. Filiopoulos with that proof. And we keep a database of those students, so we don't have to keep asking them. We have debated now, since we have the tracing happening, if we want to just go ahead and have students. I was approached by a student today asking if they just want to send it to me, and that's fine, and we'll just keep a database of it in that one. But we've received a lot of them because we've had a lot of conversation with a lot of students, but because we've had quite a few cases here since Friday and Monday today.
Yeah, okay. I just wondered if you have a database put together where they.
We do have that growing, yes.
The only trouble too with something like that is if it's only good for 90 days, then do you have a timeline for everybody on when their vaccination no longer becomes valid?
The vaccination's longer than 90 days.
Oh, I was led to believe that it was only good for 90 days.
Vaccine?
Once they test positive, it's good for 90 days.
Oh, okay, so,
If you get COVID,
right.
that's 90 days.
And that was kind of what I was getting at earlier, was that it seems like getting COVID, which would be a good thing for your immune system, should you overcome it. Why is that not treated the same as getting a vaccine? Why is it only good for 90 days if you get it, but the vaccine's good for much longer? Because that's the exact point I raised earlier. And I'm just saying, I mean, you get chickenpox, I was taken to someone's house to get chickenpox when I was 8. I was told, you're going to get chickenpox. That's why you're going to Jimmy's birthday party.
Not this is the concept. I would tell you, our numbers are much lower than several districts in this county.
Our numbers of what?
Students who are quarantined.
Oh, okay. Gotcha.
The steps and efforts are making with trying to group kids to limit the quarantine is working some.
Well, that's what I echo what these guys said about just praising the efforts to limit it as much as we can. Like, so to me, the biggest benefit or purpose of the discussion tonight was how can we further limit that to make y'all's life easier and make students' education experience as good as it can be. So.
In the meantime, if you have something else you want me to get to you on next Wednesday night, I can do that. Just let me know.
Okay. Does anybody else up here have anything else? All right. Well, I appreciate everybody's interest. Obviously, this is a topic of great interest, not just here, but everywhere. I would encourage, and I appreciate, to me, there's nothing more beneficial than civil, rational conversation and the ability to come up with an actual decent outcome. So I always tell my kids, if you're gonna get any point across, you need to share information, you need to do it in a respectful manner, and you might actually accomplish something. As soon as you start yelling or getting emotion into the scenario, whoever you're talking to is closed off and they're done. They're not gonna listen to you and they're just gonna come back with emotion and nothing will get accomplished. So I do appreciate good information, good rational discussion, and hopefully moving forward, we can come up with the best solution possible for our district, for our community, for our staff, for our administrators, because I'm frustrated, and I'm not here every day, in terms of the fact that when we got through last year, there was a vaccine, and I thought, all right, we'll have some sort of normalcy this year, and now here we are again, so, we'll get it figured out, right? As we did last year, we'll get it figured out again in terms of what works best for us. Anybody have anything else?
Motion to adjourn.
Brandon moves to adjourn. Steve seconds. Any other discussion? Roll call.
Mr. Kern?
Yes.
Mrs. Young? Yes. Mr. Renier?
Yes.
Mrs. Psalm?
Yes.
Mr. Sharp?
Yes.
It's good to see you guys.
Next time, we're running all Well, it's funny, it's actually it's a constant, but it works. We're there, I think. You're not holding us together.
The only reason I got all these hard workers today is to announce the meeting.